Representative Kane.
Thank you, Chairman. Currently, we're collecting 4.5% through the hospital assessment tax, correct? Who's paying that tax? Where are they getting the money? Hospitals don't generate money on their own, so where's the money coming from?
Well, similar to other taxes that they pay as they operate, it's a part of operational costs from hospitals. So collections and revenues from all sources would go in to pay the tax. And
so this is people who are insured are paying this tax currently. Is that correct?
The payers, yeah.
So,
yes, those are off-payer sources.
Yeah, the assessment is levied against total patient revenue, so the hospital pays that. The assessment then is matched today at our traditional Medicaid rate, which is so for every 35 cents or so that is put forward, it's matched with 65 cents from the federal government and then earned back by the hospitals as they serve today Medicaid patients, in the future Insure Tennessee patients. So, I mean, hospitals are willing to do this because the funds that result from it exceed really what they pay.
Right. So, but the insured are currently paying the tax. We're sending it off to the federal government. They're mixing and mingling and sending it back. Because the people who don't have insurance can't be paying the hospital for their gross receipts. So it obviously has to be the people who either can pay in cash or the people who have insurance are currently paying this. Where is that money currently today being used? Because it's obviously being used for something. And once we start shifting it over to pay for this program, whatever programs that the hospitals are paying for with this tax currently will cease to exist, or no?
So there's language specifically in the assessment that prevents it from being passed on to patients. The assessment today, when it's passed each year by the General Assembly, specifically indicates what it's directed to cover. When the assessment was first passed several years back, it was specifically to cover certain reductions that were going to have to otherwise take place in the TennCare program. There is room within the rules around these taxes for them to bring in additional revenue, which would be utilized to fund Insure Tennessee.
What do you mean by additional revenues?
Representative Kane, the rate today is 4.52%. The hospitals the industry who brings this bill every year could determine what they wanted to set the rate at with the General Assembly's approval, or they have other options for generating more revenue. The Dr. Long's point is that is not the maximum amount of revenue that they're allowed to generate.
Right, it can go up to 6%, correct?
That's correct.
And so, again, that's going to be assessed on people who can pay to help pay for people who can't pay?
It's assessed against total patient revenue that the hospital brings in.
Okay, so define that word, total patient revenue.
Well, I would rather have the hospital association do it, but I think it's all of the revenue that the hospital takes in as a result of providing care. And then, in turn, they receive that money back as they serve patients who have Medicaid, or in this case, Insure Tennessee.
Okay, and along this line...
It's not a net loss to them, I guess, would be my point.
And back to Dr. Long's point, the statute does say clearly that they can't pass it on to the consumer.
Right, but the funds are being used for something, correct? They're just not sitting in a checking account. When they're collecting this fee and getting money from the federal government, it's being used for something that once we direct this money to be used for this program will cease to get paid for. What are those things that will cease to get paid for?
Well, you are correct that it funds Medicaid services today, but I don't think the hospitals are contemplating a redirection. I think they are contemplating bringing in additional revenue through the assessment.
I mean, because it's a limited amount of money that we're talking about. So if you're using it to pay for this, you don't have it to pay for that. It's not like you can create money in this situation. We'll move on. The Supreme Court is going to hear a case this year about subsidies. I mean, probably 80% of the people, I write health insurance. Almost 80% of the people who write health insurance are getting some kind of government subsidy, because I believe it runs up to 400% of poverty will get you some kind of a subsidy. Assuming that the Supreme Court determines that the subsidies are not fair and therefore are not part of the plan, you'll have, when people start having to pay the actual cost of health insurance, you will have people dropping their plans like rocks. So how is this plan going to be affected, assuming in June the Supreme Court decides that the subsidies are unconstitutional?
Representative Kane, I think we would say it's impossible to predict how the Supreme Court's going to rule. We believe the matter before them does not impact what we have proposed today, and it would be impossible to anticipate exactly how they will rule. But the main issue that they are deciding is not related to what we have proposed through Insure Tennessee.
Well, but these people are getting a subsidy, and now they won't. And so they could be back and dropping into your plan. Do you have a plan B if this were to happen?
The qualification for Insure Tennessee is below 138% of poverty. If you're above that and you're receiving a subsidy today and something changed, it wouldn't necessarily then qualify you for Insure Tennessee.